My name is Steve Howard. I am the Executive Director of the VSEA, which is a union that represents the state employees who work in the dispatch centers, the PSAPs. I have worked for VSEA for 3 years, and at first I was their lobbyist, and now I'm their director. The dispatchers are sort of the first responders of the first responders. They take calls from Vermonters who are in need of help, and they dispatch either local police, fire, ambulance to various locations throughout the state, or they dispatch for the state police who cover all of the state. So the governor last year, his budget proposed eliminating 2 of the PSAPs, public service answering points. That's what PSAP stands for. He wanted to close the facility in Rutland and close the facility in Derby and consolidate those services to Williston and Rockingham. And it potentially could have resulted and did result in a significant number of losses in terms of folks who are on the job in those locations. Some of those folks moved to those new locations, but it really cost the state a lot of local knowledge of the streets, of the landmarks, of the personnel that they were working with and they had been working with for a number of years. And it really was to save very little money. I think the savings was less than $2 million. Out of a $5 billion budget, it wasn't a huge cost savings. I think it was, if I remember correctly, I think it was about 1.9 million, between 1.7 and 1.9 million. In the end, I think we haven't seen the final result of that yet. In the end, my hunch is that they didn't save very much because they had a hard time finding experienced dispatchers who would move from one location to another, and had to offer fairly significant incentives to entice dispatchers who worked in Rutland or in Derby to travel to either Williston or Rockingham. So in the end, my guess is that the plan didn't save nearly as much as they promised. So the centers, it looks kind of like a call center. Lots of computer screens, and there's sort of kiosks where you see a number of folks who have headsets, and there are different stations in each PSAP for different kinds of calls. So there is one station where local calls come through, and they're open 24 hours a day, 7 days a week. There's 3 shifts. They are constantly staffed, 365 days a year. But we are against them. Our members are against them. We mounted the campaign against it, and we were able to partner with a lot of local police, fire, EMT folks across the state who are also very concerned about the loss of local knowledge. We had a very robust public hearing where there was a big crowd of Vermonters who came out on a winter night to say that they were opposed to it. In the end, we think that this wasn't a smart move, and you don't know what's going to happen in the future, but my guess is that they're going to see that this wasn't what they thought it would be and what they promised. It's a little hard to tell. There were a number of positions eliminated. Off the top of my head, I'm thinking it's about 14 positions that were eliminated. That doesn't necessarily mean there were people who lost their jobs. Some of those folks moved. What they really did was move positions from locations from Rutland and Derby to Williston and Rockingham. And the way it works in state government is there are positions and people fill those positions. So you may have different people filling those positions at 2 different locations. So it's unclear based on the fact that they, in the end, had to really incentivize people to go to these 2 other locations. I'm not sure how many people actually took them up on those incentives and how many of those people are still working, and my recollection is about 14 positions. I've heard anecdotally from people that a lot of what we express concern about, or a lot of what the first responders express concern about, has actually come to fruition. So people giving them bad directions in some ways, not knowing where they're going. It's not the fault of the dispatcher. If you live in Williston and you're being asked to do something by the management of the Department of Public Safety that you don't have the knowledge of, it's really difficult to hold the dispatcher accountable for that. You're in Rockingham and you're being asked to give somebody directions in Rutland or someplace like that. You may not know what you would know if you lived there. And so they have a lot of technology. They're relying very heavily on technology and saying that that is as good as human knowledge. The human understanding of a geographic area is much more valuable and much more reliable than the technology. But having said that, I would just say that the dispatchers who are are working under very trying circumstances and are doing a tremendous job with what the state government has provided for them. I think one big concern we have, and that all of our dispatchers have, whether they were transferred or not, is that if we had another incident like Irene, another natural disaster like Irene, where there was a real problem with sort of overload on the system, that we may not have built the infrastructure to adequately address that. So we don't know if that's going to happen. We hope we don't have another Irene or anything like that. But we know when there's even just some snow on the ground, what our members tell us is that it's hard to keep up with the number of calls that are coming in just with a snowstorm, much less a natural disaster like Irene. I do know there's a limit to what you can ask a human being to be able to do, how many hours of overtime you can ask them to work before they're just too exhausted to do their job. I think there is a real problem with the reliance on technology, and if technology breaks down, then what do we do? So it's hard to say, but those are two things I'd be concerned about. We work very closely with all of our members all throughout the year on a number of issues. Workplace conditions, the amount of overtime they're being asked to work, whether there's enough adequate staffing for the facility, whether they're being treated fairly by their supervisors. So we work on all those issues all the time throughout the year. When this proposal came forward, we quickly mobilized the impacted employees. We walked them through what the political process is like. We walked them through what the proposal was. They're really the experts, right? They know what their job is. They know their job is better than their supervisor knows. And we asked them what they thought the impact of the cuts would be. And they spelled out basically what their professional opinion was. So we could bring them to the State House, we could lobby against this proposal, and we could share the information directly from somebody who's actually on the phone, taking in calls on a regular basis. And there's a big difference between somebody who sits in an office all day and thinks they know how dispatchers' jobs go, what it's like to be a dispatcher, and somebody who's actually been a dispatcher or is a dispatcher. So we always try to make sure that those expertise of the folks on the front lines get brought forward to policymakers and to the governor. I think they were given an opportunity to express their concerns. I think they were successful in prolonging the inevitable end, or the way it ended. I think what drove this discussion was a desire to balance the budget rather than the best public policy. Had they listened to the dispatchers, we would have the 4 dispatch centers open, and I think that is in the public interest, and that would be better for Vermonters. So in the end, I would say that they were given an opportunity to speak. I'm not sure they were heard. I'm not sure they were listened to. I know they weren't listened to. We had a tremendous outpouring from the public. I think they really, especially in the affected areas in Rutland and in the Northeast Kingdom and Derby, there was a meeting that occurred in Rutland at a fire station in Rutland Town in the middle of a snowstorm on a Sunday night, and 150 Vermonters came out, the day before they have to go back to work, to express their concern and their opposition to this plan. So I think if you are someone who is intimately involved in emergency response, or you're involved in your local community, you'd probably know more about it than the average Vermonter, but it did get a fair amount of press attention, and Vermonters responded in opposition to it. Firefighters, the state's professional firefighters of Vermont came out against this proposal. A lot of folks who are accustomed to working with emergency services, I think, were the most vocal. VSEA members obviously were vocal because we don't think this is the smartest way to run state government, and when the professionals on the front lines say this isn't a good move, we think it should be listened to and heard. So, and I think there were a lot of concern among Vermonters in general. So that, I think, that's really where we heard a lot of opposition come from. They could have closed these down, at any time. The administration has the power to just close these PSAPs down at any time, and we were able to delay it for about 6 months, longer than I think they would have preferred. Because first responders came out in droves, they had a great deal to say about it, and there was a lot of respect paid to their views. It did help prolong it. It obviously in the end wasn't enough to overcome the state police position. It was first proposed by Commissioner Flynn to the governor. The Governor decided to endorse it, and then ultimately the legislature made the final decision in the House and Senate Appropriations Committees. Those are the committees that decide how the state budget is built. So it ended up being really a question about money more than about good public policy from the perspective of the state employees. They had a very big gap between the amount of money coming in from the taxpayers and the amount of money going out in expenses. They had about a $130 million hole in their budget. So they were cutting programs all across state government. This was one of them. They were also raising revenue or raising taxes, fees in order to fill that hole, which they're going to do again this year. A much smaller hole, but still another hole. So money, our bills are higher than the amount of money we make, or the amount of money we take in. So it really just went to fill that hole. The budget deficit is a cause of a few things. One, we don't have a tax system that taxes people who make money, who make a lot of money. Instead, we're taxing people whose incomes are going down. The incomes at the top are rising really fast, and those in the middle are dropping. And our tax policy taxes the folks in the middle more than it taxes the people at the top. So all the money's up here, and our taxes are down here. So there's not enough money coming into state government to adequately fund state government. And that's the major cause of the problem. There's also some expenses that are sort of running away, mostly around healthcare costs. State government has a big healthcare bill that they get every year for a program called Medicaid, which is healthcare for the poor. And that is eating up a huge piece of the state budget. A lot of attention paid to the public hearing that was held, and there was a lot of attention paid when our dispatchers went up to testify, certainly when the governor gave his speech. But there were so many problems last year in the legislature that sort of circumvented the press coverage of this issue. So that may explain it. There was that big budget deficit was the story that people covered versus the individual cuts that were in there. 34 people, their jobs were eliminated. Their positions still exist, so somebody else may have their job in a new location. So 34 of our members lost their jobs, which for VSEA is a very big deal. And these dispatchers poured themselves into their jobs. So this was really more than just what they did to make money. This is what they really believed in. They felt that they had a responsibility to do their job well so that a police officer wouldn't get shot or a firefighter wouldn't get in trouble. They did their jobs because they knew Vermonters were counting on them to do their jobs. So for us, it was very difficult to see them lose their jobs. The Rutland economy, the Derby economy, it's two of the poorest places in the state. It was nonsensical to us that you would take these well-paying jobs out of those two areas at a time when there's probably not a lot of jobs like them. Because our members belong to a union, they have access through their contract to benefits that a lot of jobs in those areas don't provide, to job security, and also to somewhat higher wages. So we thought that was really hard to watch and hard to see, and we tried to help soften the landing for them and provide incentives for them to move to the other positions. When you do something like close a facility like a PSAP or close any agency of state government, there's something called a reduction in force. The shorthand version of that is a RIF, R-I-F, right? So many of the folks, of those 34, had the ability to apply for up to 3 other vacant state positions, whether it was in the dispatch center or whether it was in another agency in state government. As long as their experience and they were qualified for the job, they could bid on up to 3 other jobs before they found another place to go. I don't know how many people chose. People have different levels of interest in state jobs. I'm not sure how many people actually took those state jobs and how many went out to the private sector, but a number of them went to the other dispatch centers to try out working there. They had up to 6 months to try working in one of the other 2 facilities. The VSEA put together a proposal that would have saved the state of Vermont the same amount of money, and it would have kept all 4 centers open, and it would have protected the jobs of those 34 people who lost their jobs. That plan was presented to the legislature. It passed out of one committee. It passed out of the Senate Government Operations Committee, and then never was adopted by the Budget Committee.